Okay, well, hello everybody, and welcome to today's launch event, which marks the launch of both the Global Centre for Healthy Food Environments and also the first research report. I'm Thomas Kelley, the CEO of Sprink, and just to get us started, I wanted to express my thanks to my colleagues, Maile, who leads our work within the Global Centre for Healthy Food Environments, and Ed's colleague, Matt Salt, who's part of Ed's team. Also, the community of experts, which has been critical and central to the first piece of research that we've done, as well as to Phil Shelley, who joins us today from NHS England, and our launch event earlier today, Veronica Graham, who joined us from Western Health in Australia. And of course to all of you for taking the time to attend today's event. I hope that today marks the start of a relationship between us and you as we collectively build the momentum behind some of the great work that you'll hear today from Phil and others around the creation of healthy food environments within our healthcare systems. So with that, I'll pass over to Ed. Thanks very much.
Thanks, Tom. Okay, so as Tom mentioned, my name's Ed Maile, so I'm a senior consultant at Sprink and also lead of the Global Centre for Healthy Food Environments. That makes up about half of my working week, and the other half is as a GP so primary care physician in the NHS in England. And so having worked as a doctor in a primary care setting now, but earlier in my career in hospital, I've got first-hand experience of food within healthcare settings, and that's really what's ignited my interest in food in healthcare, the kind of juxtaposition between an organisation which is focused on health, but then often doesn't support health by not serving good food to its patients, staff and visitors. All right, so I'll just take us through the agenda for this afternoon in England anyway. So I'm going to introduce Sprink's Global Centre of Healthy Food Environments to start. I'm then going to hand over to my colleague, Matt, who's going to launch our report, Defining a Healthy Food Environment Within a Healthcare Setting. This is a piece of work we're really excited to launch because we think it's exceptionally important to have a clear definition of what good looks like in the context of food in healthcare settings, so that all organisations working to improve their food provision for patients, staff and visitors have a clear benchmark and aim to work towards. So you'll hear more about that. And then we'll hear from Phil Shelley, our guest speaker, who we're honoured to have joining us, and Phil will be introduced more formally by Matt later, but he's going to give us a global perspective. Well, he's going to give us a perspective on healthy food environments and specifically on the work happening in England. And then we'll have a Q&A. So I'd really encourage you all to submit questions via the Q&A function. And the Q&A will be chaired by Tom, and hopefully we'll have a rich discussion then. And then finally, I'll wrap up with discussing some next steps and opportunities for future involvement. Next slide, please, Matt. Okay, so we've covered some of this already, but just so you're aware, the event is being recorded. As an attendee, you won't be heard or seen, so everything will be anonymous from that perspective, and we will share a copy of the recording after the event's completed, and we'd really encourage you to share this with colleagues or anybody else that might be interested but who wasn't able to attend today. A copy of the report will be shared with everybody attending after the event, and so again, we'd obviously really encourage you to read this, and we'd welcome feedback and discussion on it, and please do also share with interested colleagues or friends, so that we can encourage a richer debate around this and discussion around it. And yeah, finally, we've mentioned the request for questions for the Q&A. Next slide. Okay, so the first section of today is to introduce the Global Centre of Healthy Food Environments here at Sprink. Next slide. So first of all, who are we? So you've heard from Tom, who's the CEO of Sprink, and you've heard from me. So as I mentioned, I'm lead the Global Centre for Healthy Food Environments. And then We have my colleague Matt, who's a senior project manager and is responsible for much of the day-to-day work in the Global Centre for Healthy Food Environments. And Matt will present our research reports later. Next slide. So first, just a very quick overview about Sprink in general. So Sprink is a mission-driven organisation with a strong social purpose. We focus on two areas of health which we hope to make progress in. So the first area is person-centred value-based healthcare. So you can read much more about this on the Sprink website, but in brief, we're working to help people enjoy the health outcomes that matter to them at a particular point in their lives. And we're working with healthcare systems, universities, and industry to achieve this. Our second focus is healthy food in healthcare settings, hence the Global Centre for Healthy Food Environments, and I'll talk much more about this over the next few slides. And then our final focus is bespoke services. So these are long-term relationships with individual organisations aiming to provide dedicated, tailored services which focus on either person-centred value-based healthcare or healthy food environments. So that can include things like strategic advice, developing bespoke education programs, or developing or conducting commissioned research projects. Next slide. All right, so on to food. So first of all, some context. So what is the challenge with food environments in our healthcare systems? And I'm sure this will be familiar to many of you, but I think some of these challenges are so big that it's always good to be refreshed about them. So first of all, there's rapidly growing interest among consumers, health professionals, governments, and organisations in healthy, sustainable, and ethical food. And why is this? Well, the reason is that there are huge global challenges that we're collectively facing, and many of them are due in part, if not largely, to the global food system. So firstly, from a specifically healthcare perspective, there's significantly high rates of obesity and non-communicable disease, much of which is attributable to diet. Secondly, we're experiencing an ongoing climate emergency, and the food system has significant impacts on this. So the food system is responsible for 1/3 of all greenhouse gas emissions globally, and is the #1 cause, sadly, of biodiversity loss in the world. And so in the context of our shared global goal to limit temperature rises to 1.5 degrees, reform of the food system is really essential. And then thirdly, we've seen a significant increase in the interest in plant-based diets, particularly in the West in recent years. And I think much of this is due to increasing recognition of animal welfare issues within the global food system. But also there are significant worker welfare issues in terms of human rights abuses in food supply chains. And clearly reforming this should be a priority. And so then in the context of these global challenges, there's therefore rightly growing expectation that organisations do their bit to try and address this. And healthcare organisations are particularly well placed to do this because they're organisations which people look to take a lead and listen to and respect. And they're also anchor institutions. So an anchor institution is an organisation that has a significant impact on its local community through training, employment, procurement, etc. And so we therefore think it's really essential that as health-focused organisations, healthcare institutions are taking a lead on providing healthy, sustainable and ethical food to their patients, staff and visitors. Next slide. So all of that leads to our vision, which is that healthy food environments are food environments underpinned by the latest evidence that enable and promote healthy, sustainable and ethical diets, with the food being tasty and affordable as determined by different sociocultural and socioeconomic groups. And just to quickly pick out a couple of those points, we think it's really important to be evidence-based and try and step back from some of the emotion around discussion of diet. And we also believe that in the context of significant health inequalities globally, that it's really important that any interventions are equally, if not more, applicable to those on the lower end of the socioeconomic status as to those on the higher end. Next slide. And so how are we going to try and achieve this at the Global Centre for Healthy Food Environments? So we have 4 key areas of activity. So focus number one being research. So you'll see this talked about in much more detail when Matt launches our research report in a moment. But essentially, we're aiming to undertake research to understand healthy food environments in much more detail, and specifically to think about practically the best approach to implementing them in the real world. Secondly, education. So we're developing a virtual education program with the aim of equipping people with the skills and knowledge needed to improve the food environment within their healthcare setting. Thirdly, implementation. So working directly with organizations to help them to improve their food environment. And finally, community. So bringing together a community of organizations and healthcare systems who have a shared goal of improving their food environments with the aim of mutual education and mutual inspiration so that we can all move forwards together. Next slide. And so how can organizations engage with this? Well, we have a membership model. So the aim of this is to create a community of organizations with the shared focus of improving their food environment. We do focus on healthcare settings, but actually members can be hospitals and healthcare institutions, but they can also be universities with a significant health focus, or government bodies who focus on health as well. And then the activities that members can engage in, so they align with the 4 previous activity areas I mentioned, those being research, education, implementation, and community. Next slide. Okay, so that brings me to the end of my presentation. Just a gentle reminder, if you do have questions, please do submit them via the Q&A. And I'm now going to hand over to my colleague Matt, who's going to launch our report on defining healthy food environments within healthcare systems. Thanks, Matt.
Thank you very much, Ed. So as Ed mentioned, obviously anecdotally, we have some experience of using food environments within healthcare settings. And it's through these that we'd identified areas for improvement. When we started the Global Centre earlier this year, we carried out a prioritization exercise in which we consulted with leaders in the area and identified these 3 topics as being areas to focus on in terms of the research. So the first is around a definition. So exactly what is the definition of a healthy food environment within a healthcare setting? We did a short review of existing literature and identified that that was a gap. There is no commonly used definition of a healthy food environment. And obviously, if we're aiming to move towards something that is a healthy food environment, we need to know exactly what it is that we're aiming towards. The second thing that we look to do once we've moved on from the definition is identify how we can develop and implement these healthy food environments within a healthcare setting at scale. And then the third priority is to look at how we can involve the food industry to ensure that any response that we make towards the existing situation is holistic and it uses all the stakeholders who are obviously important to delivering these healthy food environments. So just a reminder that this is what we're launching today. So exactly what is the definition of a healthy food environment within a healthcare setting? And in terms of the methodology for doing so, it was very much a 3-step process. So the first was around convening a community of experts. This was a group of 17 individuals across 10 countries. And obviously, to make sure that it was as widely applicable as possible, we tried to include as many disciplines, geographies and organizations with a degree of relation to healthy food environments and the healthcare setting. Second, the Sprink team conducted a rapid review of the literature, and this included both academic and grey literature to identify whether there were any pre-existing definitions of a healthy food environment, or indeed aspects that could be applied to that definition. And thirdly, to get consensus from across the group, we used a modified Delphi process, which I will touch on in a few moments. So the community of experts, you can see a map here of where they came from. Essentially, we had experience across that group in public health, academia, nutrition, health policy, food policy, behavioral science, and environmental science. And the research methodology that we used, so it was a rapid review process made up of that, the academic literature review, and a grey literature review. So within the academic literature review, we were looking at PubMed, and we used synonyms of a healthy food environment and healthcare to identify any literature that may be relevant with a definition. We did a title, an abstract, and then a full text review to identify any components. And then simultaneously to that, we also carried out a grey literature review. So recognizing that this is a fairly young field in terms of the existing research that's happened around healthy food environments in a healthcare setting, it's fairly limited to more sort of policy and organizational documents. So we thought it would be useful to study that grey literature as well. We identified those papers through Google and then reviewed the references from each of those papers to identify as much relevant literature as possible. Then once we'd completed those two steps, we then looked to extract the outputs of those papers. So where there were any existing definitions of a healthy food environment, we looked to identify those. And then also, as I mentioned, the potential components of a definition. And then in terms of getting consensus, so a modified Delphi process was used. This was a virtual process in which 3 surveys were sent across 3 weeks. In the first 2 rounds, the community of experts were asked to rate each of the components that we'd identified within the literature reviews on a scale of 1 to 3, 1 being not at all relevant, 3 being absolutely essential to the definition. We then used a threshold to say whether we had reached consensus for each of those components. And then in the final round, we used a binary yes/no vote to determine the final inclusion and exclusion of the components. Between the rounds, we recognized the need for as much feedback as possible. So, and recognizing that the group was a diverse group, we wanted to try and encourage as much discussion and feedback from across that group, such that they could make informed decisions in subsequent rounds. Additionally, we gave the community of experts the option to suggest additional components that would then be featured in subsequent voting rounds. And then in terms of the results, so we were left with around 37 components that were considered to be essential for a healthy food environment. And these covered 3 key areas. So the first was around procurement, the procurement of food within a healthcare setting. And so that includes the sourcing and the purchasing of food and drink. A lot of these components may seem fairly obvious, but there are a few that we think are worth calling out. So things like food safety practices, we recognize that they are they should be important anyway in terms of keeping people as safe as possible. But certainly with that focus on minimizing the risk of zoonotic diseases seemed like something that the community were keen to ensure would be included. Then as we look at food composition, so this refers to the type and nutritional content of the food and drink. Again, a lot of these won't be particularly surprising, the inclusion of fruits, the inclusion of vegetables. But things that kind of jumped out at us were around the deliciousness. So there's often a preconceived idea that healthy food and hospital food can't necessarily be delicious. And obviously to encourage as many people as possible to consume that food and drink, we need to make sure that that is certainly prioritized. Another item on this food composition was around the variation of menus to include seasonal produce. So recognizing that to be as sustainable as possible, we would like to encourage organizations to put that as a focus as well, such that we're able to provide a diverse range of food and make it as sort of sustainable and accessible as possible. And then finally, the food environment. So this refers to the physical environment and the culture of the organization of the healthcare system. And again, some things may seem very obvious in this, but we were particularly impressed with the inclusion of a designated breastfeeding area. So this was recommended by one of the members of the community of experts who identified that as a need, and obviously to make sure people feel as comfortable as possible with healthy eating, but also healthy behaviours, then the inclusion of that would certainly be useful. Another item that sort of struck us as being important here was around the inclusive environment for all body types. Being able to make sure that the space is as accessible as possible to all users, and make sure that there's no stigma involved with what we're eating was highly important. Obviously, there are 37 components that were considered essential for a definition here. So we then undertook a process to try and distill these components into one meaningful definition. The Sprink team, so myself, Ed, and Tom, drafted a definition. We shared that with our community of experts and gave them the opportunity to feedback. And this was done a couple of times in an iterative process to result in the final definition. And that's what we've got here. So to Sprink, healthy food environments are those that within healthcare settings provide a diverse range of accessible and delicious food and drink options which benefit the health of the consumer. They have surrounding environments which encourage healthy eating, and they serve food produced in a way which is sustainable and ethical for the planet, humans, and animals. And this is detailed in our report, so we really recommend that you take a look at this. We'll be sending that out after the meeting, and take a look, see what you're able to take from our findings. But now, without further ado, we would like to invite our guest speaker today to give perspective on healthy food environments, this time with the NHS. So I would like to introduce Phil Shelley, who is a civil servant at NHS England and chaired the NHS 2020 Food Review, to give us some insight on the progress of healthy food environments within the NHS. Over to you, Phil.
Thank you, Matt. It's absolute privilege to be part of the wider group here, and I suppose I just want to give you a bit of an overview of what we've been working on, and I hope that it reflects really well into the work that Sprink have been leading. Apologies in advance, I'm in a working environment today, and so if there's any noise going on in the background, I'll explain why in a little bit. So first of all, I mean, what's important for me right now is understanding this global report, and also what have we been doing through the food review to ensure that, for Ed, Tom, Matt, and all of us, we understand that the setting is challenging right now. So how can that healthy food environment be introduced? The next slide, please, Matt. So for those of you who don't know, the independent food review was requested as a root and branch review. So although it sadly followed the death of 7 patients through listeria, which were in patient sandwiches within hospitals, it became abundantly clear that a large number of positive changes needed to be made, and if we were going to improve services across patient, staff, and visitor food service. So, for example, nutrition, hydration. How do we strengthen the role of our clinicians, our dietitians, and our allied health professionals? So they need to be linking with our catering teams to understand those pressures. And of course, technology, we know that digital is really important to the government and also to the NHS. How can we drive that consistency of information through those appliances? We have patient screening, we've got electronic meal ordering, there's food waste, and of course, safety controls. And new builds right now, they require sufficient space. They require the equipment and facilities for the future. So we need 24/7 facilities that we hope would look after our teams at all times. Food that is health enhancing, suitable choice. It's available and supportive in the surroundings that they're working in. And with food safety, well, healthcare should not be following trends of food safety. It should be leading with effectiveness, with the highest of compliance. Also, strong working relationships to shape food procurement for the future. Has already been mentioned by Ed and by Matt, that high standards of products, either using national frameworks, but also the ability to link into small and medium enterprises. How can we introduce that seasonality? I know many chefs that I work with say, well, why are we seeing things like strawberries and raspberries on our menus in December? It's obviously not from Britain. So therefore, we need to have that flexibility, which is not easy in the healthcare sector, something we're trying to introduce. And of course, enforcing standards. If we are to have standards that across our health systems drive quality, then there must be an ability to enforce and of course be monitored. I'm currently now in the middle of NHS Chef 2022. That's a national competition for our chefs across healthcare. We're trying to introduce innovation, improvement of skills, and recognizing success. That's why there's pots and pans banging around in the background, so I apologies for that. When taking on the responsibility of the review, what we didn't want it to be was a one-drop shop. We needed it to be something that made a mark in time. And fortunately for us, the Department of Health understood that. We now have a 3-year program, Great Food, Good Health. And I think that speaks volumes of what we're trying to do through this global report. Slide 3. So what we must have is a collaborative approach. Our industry is incredibly fragmented in the UK. Whether that's through public sector, whether that's through hospitality or both, we're under pressure with a number of challenging influences. So we need to take teams, organizations, associations, as you can see on the screen, our companies and our colleagues with us on this journey. That needs to happen. It's essential if we are to experience success. Next slide. So having clinicians, dietitians and caterers working in harmony helps us to drive our recommendations if we're going to reap the rewards. We have a panel of 14 that are working closely together across the whole of NHS England to ensure that we pull together our good practices and our challenges. And I believe that this will also be reflected as we understand the gap analysis of our systems, how we should encourage that healthy food environment. Next slide. So, exemplary. Well, what we have experienced is understanding exemplary. What does good look like? How can this be shared, influenced, challenging our poor decision making? So we've decided to take on 20 catering exemplar trusts across the country in every region to ensure that they become that beacon of light. They can help advise, they can support those trusts that are struggling. Next slide. So for me, there are 3 key areas here. Understand the people that we serve. That's critical. If we're going to raise the profile around the quality of the food purchased for healthcare, the settings of environment, and our colleagues that work in such challenging conditions, we need to understand the quality of our food and how can we lift it. And what does exemplary actually mean? Well, it means being able to excel in the role that you provide. And we personally know across healthcare, we need everybody to be pulling in the same direction. Our exemplar trusts show partnership working, and it needs to take place if we're going to collate this report with Sprink. This involves a huge range of expertise, of experience and ambition, putting people at the center of our decision making. Leadership. Well, my goodness me, in the UK, we have experienced a variety of leadership over recent months. If we are to make appropriate steps of success, we need leaders to be courageous, loyal to their belief, agreeing a definition was only possible by all of us, by listening to each other's views and looking to achieve an appropriate balance. And the final slide, I thought it was appropriate as we're in 2022 right now, and to celebrate last year's, you know, anyone and everyone can achieve success if we're guided and supported through a fundamental strategy. In the NHS, our patients are eating for good health. Our colleagues in the workplace should have the option to be in a healthy eating environment. And I think these are the first steps to take us to that place. Thanks, Matt. I hope that sort of explains where we are right now.
Absolutely. Thanks so much, Phil. And I've seen we've had a couple of, well, one or two questions come into the Q&A so far. Tom, I don't know if you'd like to share those questions and any thoughts you've got on the on Phil's presentation.
Yes, thank you, Matt. Thanks very much. Okay, so great. So yes, as Matt says, we've got time now for questions and discussion, and we have, as you say, Matt, seen some of the questions coming through. I would encourage you, though, now that you've heard Phil, you've heard Ed, you've heard Matt, and reflections you've got, to just pop those into the question and answer box. So it's not a normal chat box, it's the Q&A box. You just enter them there and then they'll come through to us, and we'll pick those up. But we'll start off with the one of the questions that's come through, which there's a number of questions in this. So I'll read through it. And then I think we'll start with Ed to give a perspective, and then hopefully, Phil, we can move to you, and then Matt, if there's anything from you. So why not define the food composition more precisely? How much meat? Is it primarily vegetables and fruit? Should we use the Lancet report as a guideline? And how about patients with different diseases who require certain types of food? How do you envision taking all of that into account in the development of these healthy food environments? Ed.
Thanks, Tom, and thanks to the person that asked the question. So there's lots to unpack there, and I definitely have some thoughts on it. So I think to the first part of the question first, why not define food composition more precisely? For example, how much meat? I think I have two perspectives on this, and actually one of them relates to different patients with different conditions requiring different food. So I think I'll take that perspective first, which is that sometimes it is difficult to describe a kind of one-size-fits-all approach, because what's healthy for one person isn't necessarily going to be healthy for another person. So that we know, for example, people with different diseases, so kidney diseases, for example, may need different types of diet with different amounts of protein in. And so I think it's difficult to be very prescriptive in healthcare when you need to try and cater for individuals. The second answer is a very honest and pragmatic answer, which is that I think to have done the work to a very high standard and to be entirely confident in the answers about specifying in detail the specific composition of a diet would have been beyond the scope of this work and beyond the capacity of our team. I think that is a huge piece of work that would need a very large amount of expert capacity, which we don't have access to. So we felt, which I think we have delivered, that it's much more important to focus on a clearly defined question that we're confident we can answer to a very high standard, even if that means the scope is a little bit narrower. And I think that's what we've done. And then so the final point just to come on to is you mentioned the Eat Lancet report there, and we totally agree, and actually we do mention the Eat Lancet report in our report. And one thing that we're very keen is that our report isn't in isolation, but that it links into all of the other great work going on in this area, not least the work that Phil's leading, for example, at NHS England. But we do, as I said, mention the Lancet report, and we hope that our report is seen in the context of all of this wider work ongoing, and that it can be used in conjunction with work where there may be more specific guidelines, such as the Lancet one.
Thanks, Ed. Phil, anything that you would like to add to that?
Yeah, I think Ed's covered that really well and touched on a couple of points. You know, we mustn't forget choice. Choice is really important. And I know one of our areas, you know, when looking after people, is putting them first. So it must not be a dictate around choice. For me, it is more around the focus of quality. And there is a massive issue in the UK, particularly for us, around the quality of food that we purchase through the public sector. And there's a lot of work going on with DEFRA right now about setting standards for the future. So it is much more around putting quality over cost. So we're looking at the longer term wins, and rather than around, you know, dictating that services become cost centers, you know, and it's changing that behavior. So I agree with Ed. Let's ensure that it's around pushing the standard up rather than narrowing the choice. One of the big areas that we've learned around, you know, particularly working with Nadeem and Tanya Laperouse from the allergy, Natasha's awareness. My goodness me, we have to be so aware about everybody's choice, allergies, intolerances, and diets. You know, it's a massive market. We work very closely with the nursing teams and dietitians to ensure that we create choices that are appropriate. So let's not narrow ourselves down too much. Let's keep the choice wide, but let's put pressure on the markets to ensure that our procurement is appropriate.
Thank you, Phil. And just to reinforce too that, you know, this is a problem, or a challenge, I should say, in so many countries that and we have experience collectively of working in quite a number of these different places, and this comes up as a challenge from the worker perspective, you know, if you're working in hospitals in particular, but also from the patient perspective. And that's been part of our motivation to try and see, well, this surely we can come together more closely internationally to work together to really push this, to help push this through, so that what you were describing, Phil, it actually becomes the norm across many countries and not the exception. Phil, there's a specific question, I think, to you here, which comes from Kath Fenton. Are the 20 exemplary trusts already decided, and how do we link in with them to understand their challenges and successes? Yes,
we started with 10 trusts, we went up to 15, now we're at 20. We want to have 30 over the next 6 months. So we want to ensure that we've got the 7 regions of England, that we want, you know, at least 3 up to 4 or 5, depending on obviously the size of the region. We want to ensure that there is capacity, and particularly taking into consideration, for us, it is not just about acute, it is about community and mental health and experience, understanding those challenges and experiences as well. So I would say to anybody that's out there, if you want to reach out to an exemplar, or if you're from a healthcare setting that would like to be an exemplar, then please contact me direct, and I'd love to have that conversation. I'm picking up, Tom, as well, what you said. I think we are really hungry and thirsty right now to understand across the whole world, what are they getting right, and what can we all learn from each other? You know, there's nothing worse than all of us going through the same pain. You know, if somebody has gone through that challenge and that pain, how can we learn how they moved forward quickly through that, so we can all move you know, forward together. We've certainly learned a lot from Canada and Australia right now around some of our services, and I'm really, you know, keen to learn more, particularly through Sprink.
Thank you, Phil. And we've got another comment here from Austin, Austin we know from Imperial College in London. I'm happy to discuss internally if Imperial Healthcare NHS Trust would also like to be considered an exemplar. So, and maybe we feel we could always share your email address if you don't mind, so that if there is interest, that you're able to notify Phil directly. Okay, so we great, yes, and that's Austin. That's the point you've just added there. So then we have a methodology question, which takes us to this aim at having a definition. So Ed, maybe this can go to you. And the question is as follows. There's a couple of parts to the question. Concerning the process used to develop a definition of a healthy food environment for healthcare settings. Number one, how were patient perspectives taken into account for the definition development? And number two, has the definition been tested with patients, and what has been the feedback?
Yeah, really good question. Thank you for that. So as you'll see in the report, we did have a patient representative on the in the community of experts, and so they provided a patient perspective on the definition, and they participated in the modified Delphi process as we went through that. We didn't specifically test the final definition with a group of patients. And I think that's a really good thing to pick up, and potentially is an area that we could work on in the future, because clearly it's important to test the results of the research with the kind of end consumer, as it were. But I think I would just make one point, which is that I think with food specifically, all of us eat, and nearly all of us access healthcare settings. And so I think whilst I absolutely believe that patient involvement is important, and we did do that during the process, I think it's equally important to recognise that actually everybody on the community of experts is also somebody who does have intimate experience of this on a regular basis. And so I think it's not quite the same as sometimes in research, where you've got a very specific question, which is only experienced by a very small, or not necessarily very small, but a defined population of people who are experiencing a certain healthcare condition, for example. This in contrast, is something which is common to every single person in the world. And so I think, which I think actually is why it's so powerful, and why people often are so engaged with it, because we all are intimately acquainted with the sensation of eating good and bad food, and the impact that can have on how we feel and on our health.
Thank you, Ed. I think that's a compelling answer. And just to also reinforce there, listening to you and looking at the question, that of course it is important to say this isn't just about patients, that patients are important, but it's every bit as important for staff and also visitors. And I think particularly at the moment, where staff well-being across health systems all over the world is a big challenge. Speaking from personal experience, it's actually quite annoying if you are working hard and you can't actually get something decent to eat. And that, it goes a long way to, I think, to not being, it's not a panacea, but to contributing towards improving staff health and well-being if there's decent food that's tasty and affordable that we can eat. Now, another question, and Phil, I think this one to you, if you don't mind, from Tilly Robinson Miles, and I think it's a really, really important question, Tilly, actually, that you've raised here. So I'll read it all out. How do you think this work could relate to social care? I know this is healthcare, which I think, Tilly, healthcare, we do capture in that health and care. It is about social care as much as traditional health. But a crucial element to this is following hospital discharge. Food is so often ignored, with the loss of things like Meals on Wheels, support services following discharge. Is there any transferable learning, do you think? For example, in Scotland, in relation to the development of a national care service. Is that something, Phil, that you'd be able to comment on?
Certainly seen some very good practices about how the care is transferred you know, from entering hospital, going through the system, and in the way, and I don't like the word discharge. I got to say, kind of, it doesn't bring the best out of a food service, does it? If you're leaving hospital and you're thinking about that care package, but it's a clinical term that we use, and it's kind of, we started doing it through a few trusts, and we were kind of doing what we call kindness bags, and they were starter bags for people to go home, where you had, you know, things like the simple bread, margarine, jam and cheese, and the basics, and milk and things like that to start them off, and that would help link into the whole care system with their relatives and the package that they would have once they're home. But it's quite obvious we've been through, particularly the last couple of years, incredibly challenging, where people are getting home before they're either ready or their support mechanism is not ready. And we need to join up health and social care. And for us, what an opportunity to look at that environment, not just about food and drink, but the whole environment and the care that we should give people. You know, we talk about the National Health Care Service. Sometimes the word care is the bit that's taken out of it. It is more about a service rather than the care of that person. So we have starting to look at how can we link with things like the Meals on Wheels. In fact, on Monday, we're going to the House of Commons to be involved in the launch of Meals on Wheels Week, which is, you know, it is still happening around the country, but services are being very much squeezed. So I think it is something that we should be asking the government to re-enhance, to really put some funding into that. Our elderly groups are getting bigger and bigger. We need to be focused on how do we look after them and ensure that the care package goes all the way through the system. It doesn't stop when they leave hospital. And I think that's, you know, it's not professional, incredibly uncaring to think that there's a cut-off point because it's out of somebody's remit. So we need to join up services. We need to learn from Scotland, and we work personally with Health Facility Scotland to learn from them, to think how are they doing things well, and how can we sort of reflect it. But I think it's a great point from Tilly, and happy to link in with her at some point and try and, you know, share some learning with her.
Thanks, Phil. There you go, Tilly. Hopefully that's a helpful offer from Phil there. I'm going to end, I think, with one question that is a question that we've spent a lot of time thinking about, and maybe this is something that can go to Phil, Ed, and Matt, and just short perspectives each. I'm just watching the time here. We've sort of touched on this a little bit as we've gone through the answers, but how do we strike a balance, or should we strike a balance between giving people, so consumers, a choice? So, for example, should we still have options that enable people to buy chocolate and fizzy drinks on site if they'd like to, or should we not? Should we be very clear about what we see as healthy and only have those, in inverted commas, healthy options? I think we start with Ed, and it'll be interesting to hear what, Phil, you think about that, and then Matt will come around to you, and then click stop. So Ed, to you.
Thanks, Tom. Yeah, I mean, a really intriguing question that we could talk for a long time about. I mean, I think to try and give a brief answer, I think from a public health perspective, I think the answer is clear that there shouldn't be any unhealthy food sold in a hospital if your sole aim is to maximise public health. But I think this question obviously is fraught with considerations around political philosophy and liberty, and to what extent should we have a paternalistic approach to health? And those questions, there's no right answer to that. That's a philosophical question, and policymakers and managers have to decide where they sit on that spectrum. I think my personal view is that we should aim to have the least amount of unhealthy food as is both financially and culturally acceptable within a hospital, but that is unlikely to be nothing. But I think we should, I mean, ultimately this is a spectrum. And I think if we can move away from certainly the worst parts of unhealthy food in hospitals, minimize both the amount and the unhealthiness of it, and massively ramp up the quality of the healthy food in hospitals, then we'll be taking a big step in the right direction. And just to give a very, sorry, I said this was going to be quick, but just to give a final example, if you go back to a hospital in the 1980s, then it may well have been common to see patients, staff and visitors smoking potentially on the wards, but certainly on site in the corridors and around the grounds. And the thought of that now, certainly in the UK, is unconscionable. You definitely wouldn't see somebody smoking on a ward or inside a hospital, but nobody ever raises that as an issue of paternalism or the nanny state, because we're not allowed to smoke in hospitals. And I think potentially the same will be true in 20 or 30 years' time, I hope, in relation to food.
Thank you, Ed. Phil.
Ed has put that far more sensitively than I probably would have said it, but I totally agree with him. You know, a hospital is supposed to be a beacon of health, and I think we have to promote it. That we have a big enough challenge to try and express around quality and choice. That should be our focus. If people are desperate for a can of Coke or a Mars bar, there are plenty of places outside of a hospital where they can purchase it, and that is their choice to do that. For me, we should be thinking around the choice within our setting, and that should be as healthy as possible. And I would say, in just closing for me today, I think this is a tremendous platform that we've got here. I think Sprink have done a terrific amount of work here to get us in this position, and I'm looking forward to really pressing on with some ambitious targets here, together, and certainly our environment, as rightly been said already today, our environment is not just in the way we look after people, but actually in the facilities that we provide, and we need to really focus on that whether you're working, whether you're visiting, or whether you are a patient in a healthcare setting, we need to think very closely about what we're providing.
Thank you, Phil. Thank you. Yeah, thanks very much. And now, Matt, there's a bit of pressure on you here because we're ending with you. So, any additional perspectives there?
Yeah, I'd probably just like to add that obviously there's a relatively succinct definition that we've created, and then there's 37 components to that definition. And to expect a healthcare organization or setting to implement all 37 of those recommendations right off the bat wouldn't be realistic. So there's certainly an opportunity, I think, to see it as more of a step change process, and maybe only healthy food is what we aim to see as the complete gold standard. But certainly don't see it as today we have unhealthy food and tomorrow it doesn't exist, because that's not going to be realistic. And certainly in the short term, it should be about encouraging the healthy choices, the sustainable choices and the ethical choices, such that it's part of our behavior rather than an expectation that these things will be on offer.
Thank you, Matt. Thanks very much. And Ed, just before I hand to you, just a final read from here, Austin, something you've put, which I know, and Ed, I've heard you talk quite a bit about this, food security or food insecurity, and Austin's point here, which is such a tragedy, but the level of increase in the use of food banks in the UK, but of course also in other countries. Emergency food parcels not designed to be used routinely, so they're high in sugar and fat. Well, and Imperial here, Austin's group, are working with Hammersmith and Fulham Food Bank in London to consider how food options could be improved. So that's, yes, I think it's an interesting point. Thanks, Austin. Okay, so Ed, over to you.
Thanks, Tom. Matt, if you could just reshare the slides, that would be brilliant. Thank you. So in the last 5 minutes, I'm just going to share a few brief next steps and a few closing comments. Yeah, how can we try and take this forward together? What are the avenues for collaboration? So I think the first one is everybody who's attending today is going to receive a copy of our research report later today. And so we'd really love it if you shared that as widely as appropriate. Twitter, LinkedIn, Facebook, whatever your social media channel of choice is, and we really welcome feedback and discussion around that. So please do get in touch if you have thoughts and comments stimulated by it. Second of all, we're going to be publishing a formal version of the report in an academic peer-reviewed journal. So we'll be aiming to submit that within the next couple of months. And then once the wheels of publication have turned, hopefully that will be formally published within the next 6 months. So please do look out for that. In terms of next steps with our research, we're going to be starting another research project shortly, and this is going to focus on the practical implementation of healthy food environments within healthcare settings. So moving from the theory, i.e. the definition, to the practice. So how in the real world, how do we try and make this happen? Fourthly, our education program is going to launch in spring 2023. And would be delighted if some of you are interested in joining that, and that's aiming to equip attendees with the skills and knowledge required to improve the food environment in their organisation. And we will keep you appraised of that by email. And then finally, the opportunity for membership of the Global Centre for Healthy Food Environment. So as I mentioned, we're trying to build this dynamic and impactful community of organisations to make progress in this area. And so if you represent a healthcare organisation or a university or a government body, or indeed anybody else with an interest in food and healthcare, then please do get in touch with us, and it would be brilliant to have a discussion. Next slide, please, Matt. Okay, so that brings me to the final slide, which is our contact details. So you can see mine and Matt's email addresses are there. There's Sprink's website, and there's our where you can search for our LinkedIn page. So that just leaves me to thank, first of all of you for attending. I appreciate how busy you all are, and we're really grateful for the time you've spent with us today. Also to thank my colleagues, and in particular Phil, for giving a great presentation and contributing to the Q&A with some really great perspectives. And yeah, I know how busy Phil is, so I really appreciate his time. So that's everything. We hope to hear from some of you soon, and have a great rest of your day wherever in the world you are. Thank you.